I'll make this quick. My name is Dr. Emily Fine, and I'm a gynecologist, having been in the trenches for about 26, 27 years. So I've dealt with all of these issues for a very long time. But my concern here is with this bill is without the public option, I'm sorry it did have to be said today, my concern is having dealt with the nightmare of medical insurance for my entire professional life. Once healthcare is mandated, I am really concerned that basically this is just going to be, you know, the best day in the life of the medical insurance companies. And I want to know what you're going to do to make sure that without the public option, and I'm hoping the public option is still a possibility, that we can control the private insurance companies.
My colleagues in the leadership, they don't like when I stand up. It's a signal. Because I can't contain myself sitting down on some of the challenges that you all so appropriately bring forth. First, let me just thank you all for what you do in the community to make America healthier. We're all in your debt from that. And we learn from you on it because you're on the front line. And maybe if I can just put what we're trying to do in perspective. Think of it this way. I say to my colleagues, the most privileged person in America, with all the wealth and opportunity and knowledge and access, will have better health care if the poorest person in America has access to health care. If we're all in a common record, and that's why the technology of the electronic medical records is so important. Teaching hospitals teach in places where they can learn from a wide array of diagnoses, and it benefits our entire healthcare system. Having access through the community health centers, which is a very important part of what we do. We have a large increase in funding in community health centers in the legislation because they have been the first line of defense in many cases for people to have access short of just going to an emergency room when they had absolutely no other recourse. So we're thinking not to think that this is a trickle-down thing, but to say the wave of the future comes from the people. Many more people treated, many more people healthier, much more prevention, as Dr. Missouri said, early intervention. So how we put this bill together was to say, how do we, again, I give it a AAA rating, how do we improve access, increase affordability for many more people, especially in the middle class who might not fall into some subsidies or whatever, and hold the insurance companies accountable. Left to their own devices, they have done great harm to the health of America. We thought, let me just, today was today, the 6th of March? Yesterday was the 5th, that's March 5th of a year ago. Because yesterday I was making a speech in Boston, not this, but I was using these bookends. March 5th, 2009, President Barack Obama called a bipartisan meeting to the White House in the East Room. Democrats and Republicans, House and Senate. Stakeholders from outside, everybody, the pharmaceutical industry, the health insurance industry, community health centers, children's health experts, women's health, you name it, every possible manifestation of health care and public policy was present in the room. The president reached out and said, we want to work together in a bipartisan way to get this done. Senator Grassley stood up, the Republican ranking member from Iowa, and he said, he questioned the public option. President Obama said, public option, in my view, is the best way to hold the insurance companies accountable, to increase competition, and make it better for the consumer. If you have another way of doing it, put it on the table. The American people know what the doctor told us. If you're mandated to have health care, don't throw me to the wolves of the insurance companies. Give me some other option. Well, as you know, the insurance company weighed in, and you know it locally, weighed in on this in a way that prevented 60 votes in the Senate from getting the public option. But we were determined that we would get as much as we could that a public option could achieve, because it wasn't about the ideology of that particular tool. It was about what it would achieve for affordability, access, and holding the insurance companies accountable. We went to an idea that had been espoused by Republicans, the exchange. Olympia Snowe was one of the co-sponsors of, co-authors of legislation. Senator Enzi, or the ranking Republican on the Health Committee, that is one of the committees that wrote this bill in the Senate, espoused that. So for 1 year, now we have the bookend. Last week, on that last Thursday, when the President again called Democrats and Republicans together to talk about any ideas they might have to improve the legislation as it went forward. So let's dispel one of these things, that this has not been open to ideas. For the year in between, far too long in my view, the Republicans have had their chance, or those who oppose health care have had their chance to put their ideas on the table on how they would serve the American people. What we saw then was that there weren't many ideas, but the President was still open and receptive, much more patient than some of us on that score, to some ideas they had about improving the exchanges or removing more waste, fraud, and abuse, and dealing with some issues. Actually, one good idea emerged. One good idea emerged from there. And something we had been fighting for, but it helped us, which was to make Medicaid docs, have primary care docs for Medicaid be paid the same as Medicare doctors.
Right.
We have been fighting for that, but again, in the competition for the dollar, there's decisions that were made that said we may have to wait for later for that, but now we will have some of that. We had some, and now we have a little more. Anyway, my whole point is, there's enough already with waiting for another view of the world. You are either for, and I think what emerged from last week's meeting was, you are either for regulating the insurance companies or you are not. Yes. And you either are for eliminating the denial of coverage on the basis of pre-existing conditions, and you are not. That's the most obvious manifestation of reforming the insurance industry. So here we are, being for 1 year, trying to find bipartisanship and being criticized that the bill is not bipartisan enough. For 1 year, having other people characterize a bill because there isn't a final bill, and there will be in a matter of days or hours, that people could call it anything they want. It has this, it has that. I mean, it's unbelievable, the mythology that exists about what this is. But what it is a bill about innovation, prevention, wellness, a healthier America, affordability, for the middle class, accessibility for tens of millions more Americans. It's a job creator, 4 million jobs. This bill alone, not counting all the jobs that John has in the health IT and the rest of it. So when you ask, what can you do to help and how can we dispel much of what is out there? When you do something like this, we all fought very hard for the public option. We kept it alive as long as we could. Then when it came down to 51 votes, we thought our prospects are even better now. But that is not the case. Under the up or down vote, should I go into majority rule, the constitutional majority, and the reverence, the enshrinement that we have for majority rule in our country? Do these senators want to have to be elected by 60% of the vote? So again, the fear-mongering to our seniors. By the way, they have suggested these waste, fraud, abuse cuts themselves. They have to happen. But now they have suggested counseling, end-of-life counseling, or even I want to have it now myself. I'm hoping I'm not very good, but you never know. You never know. But you're mischaracterizing all of that. So in another short period of time, matter of days, we will have a bill. And once you have a bill, then you can say, it isn't in there, it isn't. Well, we say that now, but of course, until they see it on the internet, which I think will be imminent. And when we do, we need everyone who cares about this issue, cares about fiscal soundness for our country. I mean, even if everybody had great health care in America and wonderful insurance, we cannot afford the status quo, but you know that they don't. So we have health reasons why we have to do it. We have budgetary reasons why we have to do it. We have competitiveness reasons why we have to do it for our economy. So we will be, again, discreetly today we are talking, our focus has been on women, it's on seniors, it's on young people here in New Haven. You can stay on your policy until you're 26, your parents' policy until you're 26 years old, giving young people a healthy start as they go out into the world. So again, we will have the drumbeat. Better quality, more affordable to many more people in our country. And again, we will have a statement of what this bill is, so that those who want to mischaracterize it, now they will mischaracterize it, because no matter what the poster is, it could be pro-life, it could be whatever, socialism, it could be this, it could be that. Underneath it all, peel it off, it's the insurance companies. They've had it all their way. We've been playing on their field for generations, and now it's time to play on the field of the American consumer. I just want to say something about how proud I am about my members. Rosa and John and others, some of our new members, Congressman Puriello of Virginia, Congressman Markey of Colorado, freshman members. Louise Slaughter of New York has been working on the issue for, I think, decades. Passed a bill on the floor of the House last week that ended the exemption from the antitrust laws for the insurance.
Yes.
406 to 19. The leader of the Republican Party of the Congress voted against the bill, but nonetheless, 406 to 19. So again, we put down a marker. This bill will not be the last bill you will be hearing from. We do have to address long-term health issues. We do have to address documentation, because it's healthier for America for everyone to be in the loop. It cannot be, all of it cannot be done in this bill. It is made, Rosa, if you give me an unknown, when Social Security, Congress, everybody gets an assigned time except the speaker can speak as long as no time. I'm reading this book about Frances Perkins, the woman behind Social Security, and what a fight that was at the time. And again, the same people who are opposing that change, that sense of obligation from one person to the next, well, they're still with us. But in Social Security, when it first passed, the left was unhappy because they had another plan, something called the Townsend Plan. And it was not sustainable, but it was what they had wanted. And some people lost their election from the left, because the left defeated them because they didn't go with that plan, which again was not sustainable, but it was a good idea, I suppose. But it was not as good an idea of social. We're not just helping the poor, but it was a compact with everyone in America, so you could sustain a constituency for it. That's why you can't means test Social Security. Sometimes people suggest it's about everybody paying in, coming out, and not somebody doing a favor for anybody else. But it didn't cover teachers, people who worked in homes. Sounds like women to me. Farmers. It didn't include a lot of people, but then it did. So you have to start. You have to kick open the door. And as I said to members, I understand that sometimes you want to vote against a bill for what it isn't, but we want you to vote for this for what it is and what it can lead to. and we all share that value of a sense of community in our country, our responsibility to each other, again, a right, not a privilege. We're all healthier if everyone is healthier. And again, all roads lead from New Haven and